Marion, where are you today? It seems like you're on holiday. You look gorgeous.
Oh,
Where are you?
I'm on an extended holiday in the Bahamas.
Your life is one big holiday, Miss Marion. Marion, before we actually start this conversation, do you want to introduce yourself to everybody that's sparing some time to view us today?
Yeah, so hi, I'm Marion Snelling. I'm the lead nurse at 168 Medical Group, and I'm also Peer Health PCN lead nurse as well.
Fantastic. So, Marion, you actually wear two hats for us. But before we go into what both jobs entail, can you tell us a little bit about why nursing? What is it about nursing that made you, how many years ago was it you joined, that made you join nursing? How long you've been in
42.
42 years.
Too long to remember, but it's gone really quick.
Tell us a bit about why you went into nursing, and perhaps what you still get out of it, 42 years down the line.
Yeah. So I think I've told people before, it was an aunt in her uniform when I was 7. That was the first time I sort of knew or had any idea of what a nurse was. And then when I was 18, I went along for the interview and loved it. And from the moment I started training, I thought, well, this is just like being back at school. It's not a job. And when I went onto the wards, it was, this is just helping people. This is really nice. And essentially, that is what nursing is, helping people to feel better about themselves, helping people physically to get better. That's, for me, that is the satisfying side of it.
That's awesome, actually. There's one point you made that is really crucial, which is role modeling. So you mentioned about an aunt that was a nurse that you saw. So there is this bit about actually you can't be what you can't see sometimes, and your role modeling auntie was the one that got you into nursing. So that's an interesting one. Yeah. One of the things, Marion, that I find I've found in healthcare is the lack of male nurses within the nursing career. Could you give me an indication of why you think that is, and actually tell me about PA and what we've done about it? Because I remember challenging you to this about a year ago.
Yeah. So there are more male nurses coming into nursing in the mental health sector, but in the general nursing, there still aren't that many. And certainly in practice, there are not a lot. There are male paramedics, but nurses seem to be scarce, and it's not traditionally a job that males have gone into. I think the reason for that, and part of it, I regret to say, is that traditionally the pay in practice has not been good for nurses, but that's improved a lot over the last few years. And last year, my lovely CEO here challenged me to find a male practice nurse. And I said, we'll never do it. So on the back of that, this week or last week, we started our first new male practice nurse. And he is fantastic. He's come from Unity Health, which is a sexual health clinic. And he's brought with him so many skills we can convert into practice. He's going to be an absolute boon and an absolute asset. So on the diversity scale, thank you. Dealing with a lot of women as well.
We love that. We absolutely love that. Thank you for actually making sure that we are a diverse organization from that perspective. Yeah. So in terms of nursing, what I found very mind-blowing is the different types of nurses there are, certainly within primary care.
Yeah.
Take us through a few and what they do, because it's just a huge buffet of different type of nurses. So walk us through a few and what they are.
Okay, so each nurse plays a really important role, no matter what level or what training they've had. They're all brilliant. So the healthcare assistants and the phlebotomists, they're there to do health checks, blood pressure clinics. They do ECGs, hypertension, that is blood pressure. And phlebotomy. They do all sorts. They have a really varied, responsible job. Now we have the new role of the nursing associates.
Yeah, is that the same as TNA?
Yeah.
Yep.
So the TNA is a trainee nurse associate, and they will be now registered by the NMC, and they will be what's the word? They'll have to be accountable for
Okay.
what they do to be
Yeah.
an MC. They can do a lot more than a healthcare assistant, in that they will be able to make decisions about giving injections, where they'll be able to do smears. There's all sorts of other things that they will be able to do, and they will be trained to degree level, and they will also have the opportunity, if they wish, once they're qualified, to go on and train as a level 1 registered nurse. Then there are your chronic disease nurses. Your chronic disease nurses are absolutely fantastic these days. They train, I would say, almost to a consultant level with their knowledge. They go back to university, they do all sorts of courses to manage diabetes, chest problems like COPD and asthma, coronary heart disease, heart failure.
Wow.
They are an amazing bunch of nurses. And I don't think they're a cohort of nurses that get enough recognition. So I would really love to push what they do more. Then if you really want to, you can go and train as an advanced nurse practitioner. Advanced nurse practitioners do everything from minor illness to anything that walks through the door. So they're almost, some of them, on a registrar level, if not further, and they're trained to master's level, and they can go on and do further training. And there is some rumor floating around that if you have a master's, you can go on and you may one day be able to go to medical school if you so wish and you're young enough.
Oh, that's just fascinating. So there's so many different roles within nursing, and within peer we have almost all of these roles around, don't we?
We have all of those roles, yeah.
And tell us the importance of our nurses within our organization, because I think only a nurse can put it better in terms of how important nurses are to us.
So the nurses within peer are the backbone of the general practice. This came to light particularly during COVID. Quite often the only people in the first dark days of COVID that still saw patients face to face, fully kitted out, were nurses. Other specialities did see patients, but nurses opened up very soon and carried on the day-to-day things they do and the routine reviews. So the nurses have been brilliant and amazing, and nurses are really good at rising to a challenge. Give them something new to do and they'll hit that mark, and they'll do it well, which I think for some people is a bit surprising, because the traditional view of a nurse is the doctor's handmaiden. That no longer applies anymore, not at all.
And we can believe it for real. And Marion, do you want to plug in some vacancies? Have we got vacancies across peer? What are we looking for? And even if we haven't got vacancies, is there anybody that can get in touch with us in terms of wanting a nursing career? What level? Just talk to us about that.
Yeah, so we have got lots of vacancies across peer. We've got vacancies at all levels: phlebotomy, healthcare assistant, nursing associate, practice nursing, and advanced nurse practitioners. And I hope I haven't missed anybody out. And we are always recruiting. We're an ever-growing population. We've got lots of new patients joining at the rate of 0, and nurses are what feed everyone around them. So people will send all their patients to nurses for their blood tests, for their chronic disease management, for their dressings. So nurses are really the backbone. If anyone is interested, they could send their CV to me or any of the lead nurses on the website. But I'm Marion Snelling at nhs.net, and I'm always happy to look at CVs. And if I haven't got something I can give them, I will pass them on.
Fantastic. And if there's any student nurse watching TV today, what should they do? Give them some advice.
Yeah. Okay, student nurses, send me a CV. Yeah, you can send it to either the 168 Medical Group BNSSG for care of Marion Snelling, or Marion Snelling at nhs.net. But student nurses, we absolutely love. And we've got one third-year placement now who's on her final placement. And she has been so good. We hopefully will be able to give her a job. We have managed to secure funds to pay her on a band 4 until she gets a PIN number. And she absolutely loves general practice. I think student nurses coming into general practice now get a real surprise at the variation across the board. And a lot of them are interested in the sexual health side. So the coil fitting, the implant fitting, the contraception. And the newest one we've added to our big job list that we do is HRT menopause. We're really all becoming really skilled in seeing women for the menopause and getting them through it. So there's no end to what you can do in nursing. It's autonomous in general practice, and if you want to develop, this is the place to be.
There you have it, all said by the wonderful, intelligent, ever so graceful Marion Snelling, our group lead nurse at Peer Health and our lead nurse also at 168 Medical. Thank you so much, Marion, for bringing live the role of nurses to us on Peer TV. Thank you.
You're welcome.